So I know we've talked about nutrition, around micronutrients, we've talked about protein, we've also talked about potentially adding in some supplements to make sure you hit your protein goals and your micronutrient goals, perhaps even improve inflammation. But I wanted to spend a special section on the use of collagen. So if we kind of pare back and look at all of the eating traditions around the world, you'll see that most traditions are pretty collagen rich. People are eating the skin on marine animals like fish. They are eating all of the connective tissue and skin. They're cooking their meat on the bone. And they're doing a lot of braising and a lot of sort of cooking of soups where those bones go into the stock pot. That's pretty universal. And if you want to learn more, go check out Kate Shanahan's wonderful book, Deep Nutrition. If we went back even further and asked ourselves, well, what was our first sort of traditional meal after breast milk? Traditionally, 10,000 years ago, that probably would have been bone marrow and some kind of soup or some kind of broth. That was probably the first thing that happened. And in all of that is what I'm saying is a high need for connective tissue, a high need for collagen. So if you're doing those things, you're eating a ton of collagen-rich foods in a way that is regular bone broth as part of your plan, you're eating a ton of hot dogs and organ meats, and you're getting a lot of connective tissue, don't worry about it, you're probably killing it. But for the rest of us, I can speak for myself, I came up in a time where we really idealized that sashimi chicken breast and brown rice and broccoli as sort of the pinnacle of clean or peak eating. Problem is there's not any collagen in that. Now look, if you go into the research, of course our bodies are miraculous at making and synthesizing what it needs. But that doesn't mean that's sort of optimal. So yes, you can completely not have any protein during this time and your body's still going to heal to the best of its availability. But we know that if we want to hold on to connective tissue, we want to hold on to muscle mass, we should up our protein during those times. And we feel the same way about collagen supplementation. So many times we're obsessed about muscle strength and we're obsessed about sort of bony repair, but we're not thinking about the greater connective tissue health system, or after injury, certainly the amount of trauma that went into this connective tissue, and certainly surgery where we disrupt a lot of these connective tissue systems. The fascia that is entwining, the joint capsules that have to be repaired. All of those things are collagen connective tissue based. So it's a really easy practice to make sure you're meeting this collagen, you're covering this collagen need. There's a lot of great collagens on the market, and I just want to talk about how to best use them because we feel like it's a really important way to help sort of mitigate potentially slower than average healing or having my body process what it needs to process. So again, all proteins are great, they all work, our bodies can manufacture these things, but we're beginning to understand that definitely there's some benefit to some collagen supplementation, and I feel like it's an inexpensive supplement that really allows us to get a big bang for the buck. So if you want and you have access to a collagen tub, and you can get collagen at Costco online, we like the Momentous collagen, predominantly because it already has the vitamin C in it. Then what you're gonna need to do is just make sure that you're getting it. And timing on this would be, hey, if I'm planning on doing my big rehab session or a soft tissues connection session or a work session where I'm doing some blood flow restriction, or about to go to rehab, have that collagen, just 10 or 15 grams. It's not very much, it's usually a scoopful, at least within the hour before. We want to try to have those things on board so that peak collagen signaling is happening, continuing to happen. Our bodies are signaling for that, and there's some new and emerging research around sort of how we can incorporate collagen back into tendinopathies, et cetera, et cetera. But we also want to make sure you have some vitamin C with that. So if you're just using collagen without vitamin C, make sure you've got a sip of orange juice, a handful of blueberries, whatever vitamin C rich thing that you like. I know you probably got 1,000 more, like the quinoa berry, whatever it is. Totally okay, but just make sure you're having some of that vitamin C along with your collagen so you can actually utilize the collagen. One of the biggest mistakes we have is that people are using collagen and they don't have any vitamin C, and they don't realize that their vitamin C depleted through the night. So you wake up in the morning and you need to kind of put vitamin C back into your system a little bit. So again, if you're following our 800 gram fruit and vegetable challenge, that will not be a problem. But it's even easier to have some vitamin C mixed into your collagen. So what we're gonna see then is when my next dose, roughly the same time within that 24 hours, I'm just trying to keep that collagen pool the circulating aminos full and topped off. If you're gonna do a second session, then have that second collagen dose, if it's like a soft tissue section, 6 hours either before or after your last one. So making sure that, hey, I'm just kind of looking at these peaks. So if I do training in the morning, I have an hour before, within that hour of the training, I'm having my collagen. I'm gonna do some soft tissue work or some step ups or some biking. Go ahead and make sure that it's 6 hours later and then hit it again. So we have a chance to sort of signal and recover and signal so we can challenge those tissues appropriately. I'm a huge fan of keeping it right next to the coffee machine. Not all collagens are equally palatable. Some of them taste like chopped up beef bones, to be frank. Some are very, very fishy, the marine collagens. However you want to choke them down, you can. But I like these collagens by Momentous because they taste great. They've also created a new collagen shot package, which is just like a goo gel that is very easy to take. This has been my favorite to hand to athletes now as we're moving towards like what's the efficacy. So making sure that collagen is part of your plan, part of your rehab soft tissue strategy. Why we're doing that? It's gut health, it's skin, it's nail, it's hairs, but it's really just to make sure that our bodies can manufacture and really take advantage of the kinds of loading that we're doing and kinds of stimulus that's going on so that we can manufacture the connective tissue we need to get back. Because remember, it's not about big muscles, although it can be. It's always about making sure that I have the structural framework to be able to appropriately handle the forces that I'm training myself to be able to.